Hello and welcome to today's broadcast. Today we'll be taking a look back at the pandemics that shaped European history and put us on the path towards modern medicine.
Our first story is on the disease scurvy. This disease was a problem through the 16 to 1800s and is most commonly associated with sailors due to the long voyages. We know now that it is caused by a lack of vitamin C, but they did not back then and didn't have a cure until the inventor of naval medicine came along. James Lind served as a surgeon's mate in the Royal Navy in the 1700s, and in 1756 he published a treatise on the scurvy, which went over all that was known about the disease, including the different supposed causes, the symptoms of the disease, and the cure for it. He also published an essay on the most effectual means of preserving the health of seamen, and an essay on diseases incidental to Europeans in hot climates, which helped immensely in keeping sailors healthy. The symptoms of this disease are weakness, anemia, which is when a person has a deficiency in red blood cells, aches and pains including bone pain, swelling, small red spots due to bleeding under the skin, sores, and the symptoms it's most recognized for in gum disease and tooth loss. It can also affect the person mentally with mood changes and depression. The cure for scurvy finally came with James Lind's method of consuming greens like kale and spinach and fruits such as oranges, lemons, and limes. There was many methods to cure scurvy at the time, but Lind's was the only one that seemed to work. This was due to Lind's theory that it was a lack of vegetables causing scurvy. While they didn't know why it worked at the time, Lind had unknowingly discovered vitamin C and started the process of discovering vitamins.
Most people are familiar with the Black Plague that decimated medieval Europe, but not many people know there were an additional 2 waves that lasted into the 1900s. In 1825, London had become one of the largest cities in the world, which led to an increase in disease, poor sanitation, and a high mortality rate among the poor. At the height of this pandemic, the Board of Trade had passed a bill which made it easier for ships coming to port to unload their cargo. The merchandising crew did not need to be inspected, which meant that the plague could be spread much easier. A physician by the name of Augustus Granville took it upon himself to sway the Board of Trade with a letter, warning that if this was not fixed, England would face the threat of quarantine. After months of convincing, the board eventually reversed the bill, which successfully diminished the death toll. Thanks to the advancement of medicine and health education, the bubonic plague has been mostly eradicated from first world countries.
Our next disease is smallpox. Smallpox is a contagious, disfiguring, and often deadly disease that has affected humans for thousands of years.
Before any physical symptoms appear, you're struck with flu-like feelings. Later, flat, red spots appear on your body. Most of the spots turn into small blisters filled with clear fluid, which later turns into pus. Scabs begin to form and eventually fall off, leaving deep pitted scars. Blisters spread to the mucous membranes of your nose and mouth and quickly turn into sores that break open. The smallpox epidemic of the 19th century was considered inevitable in children, and no attempts were made to isolate the children from the disease. In fact, a sort of fatalism overspread all ranks of society. The disease was even bought from a favorable case. Sell me 2 penny worth of your smallpox, and the healthy child received a crust from a smallpox scab and closed his hand on it. After doctors began isolating patients, people of the 19th century began to realize that not everybody was meant to have smallpox. Naturally occurring smallpox was eradicated worldwide by 1980, which was the result of an unprecedented global immunization campaign. No cure or treatment for smallpox exists. A vaccine can prevent smallpox, but the risk of the vaccine's side effects is too high to justify routine vaccination for people at low risk of exposure to the smallpox virus.
In the early 20th century, polio was one of the most feared diseases in industrialized countries, paralyzing hundreds of thousands of children each year.
Polio is a viral disease that attacks the nerves in the spine, cutting off impulses from the brain to the limbs, causing their muscles to shrivel. At its peak in the 1940s and the 1950s, polio would paralyze and kill over 500,000 people worldwide every year.
Okay.
So let's say the young boy pictured made a mistake of drinking out of an unknown glass or shook the hand of another boy who did not wash his hands after using the toilet. Unknowingly, he exposed himself to polio. The infection set in slowly. At first, it probably felt like a cold fever, congestion, or achy joints. But maybe a week later, the boy's legs started to give in from under him and fever spiked. The virus then attacked the nervous system. The infection then overtook crucial nerves of the respiratory system, and the boy lost his ability to breathe on his own. Unable to breathe, patients entered iron lungs, which made use of negative pressure ventilation, a continual displacing and replacing the air inside of the machine, compressing and depressing the chest, simulating respiration. Soon after the introduction of effective vaccines in the 1950s and the 1960s, polio was brought under control and practically eliminated as a public health problem. This shaped modern medicine because by the end of the 20th century, mass vaccination programs completely eradicated or brought these diseases under control.
Our last story takes place in the year 1980 when a surge of men became infected with a new virus known as immunodeficiency, or HIV. Within the first year, there were 270 reported cases, with 120 of them dying from viral complications. Over time, the virus weakens the CD4 cells of the human body to the point that it can no longer fight off infection, thus resulting in acquired immunodeficiency syndrome, also known as AIDS. It wasn't until 1999 when scientists discovered that the source of HIV originated in the Democratic Republic of Congo and from there spread to the Caribbean, the Americas, and eventually to Europe. In 1984, the CDC released its first licensed commercial blood test. At this point, the number of infected had jumped from 270 to 20,000 reported cases. The 2000s saw progression in the form of medicine. A new drug known as pre-exposure prophylaxis saw a 90% decrease in the transmission of HIV, and AZT, which keeps the virus from spreading and gives the immune system a chance to recover. That's it for today's show. Tune in next time to see what we cover next.